Thank you. So, just before I start, I would like you to raise your hand if you know your age or your date of birth, just by hands. Oh, wow, everybody. That's nice. I ask this question because whenever I meet new people, friends, classmates, a question that comes up very often is, George, how old are you? Or what is your date of birth? And I'll tell them, I don't really know my age, and I don't know my date of birth. This is usually a very confusing concept in a culture that assigns a number to every person. And as the saying goes, if you can't be counted or measured, then you don't exist. And so by this definition, for several years, I never existed because my birth was never recorded. So in order to exist, in order to be a living, measurable human being, I needed to assign myself a number, a date of birth. So I turned to my mother, my uncles, and my brothers to ask if they can help me find my date of birth. What they told me was that 3 days after my birth, an old man in our village died. I guess that is helpful. And that on the day of my birth, there was a huge colony of bees in the house. But my actual date of birth was unknown. So I decided to pick a number that I think will be easy to remember. But once every year, sometimes in a very busy morning, I'll get a text message on my phone from friends saying, "Happy birthday, George." And I'll be like, "Thank you for reminding me. Today is my birthday." I grew up in a small village in Ghana, West Africa. In growing up, I witnessed a lot of deaths, the death of many friends, including my siblings and my father. This motivated me to become a community health volunteer and later a community health nurse. My service was mostly to travel to remote villages, sometimes crossing rivers, walking through dangerous bridges, and sometimes climbing hills in order to get to these populations. My satisfaction in this work did not depend on the number of people I served. As I provided immunization to children, I find joy in my heart, knowing that they will be protected from diseases that have already killed many. It did not matter the number of people I was able to reach, but the smile of that one child in the middle of this village was enough to keep me going. On the other end, I also witnessed a lot of deaths. I witnessed the death of fathers, mothers, and children, sometimes from diseases that are treatable and preventable. And so for me, this was public health. These are the people public health seeks to save. This is what public health is about. But this view of public health changed during my first experience in the National Immunization Program. I get to learn that public health sometimes is not about people, but it's about numbers. So during immunization programs, as a volunteer, you are given a quota of vaccines that you will use to immunize the children in the villages you serve. Sometimes we were given vaccines that are more than the number of children that live in these villages. So during my first assignment, I went and immunized the children in the village and decided to return the leftover vaccines. I was surprised to realize that returning vaccines was a sign that I did not work. It was a sign that could lead to me losing my salary. The expectation of my supervisors was that all the vaccines that were given to me should go, and that I should report a larger number that correspond to the amount of vaccines I receive. And the simple explanation that the vaccines were more than the number of children that exist in this village was not acceptable. When I talked to older volunteers who have been in this work for several years, they laughed at me. They said, I'm just new, that we always never return vaccines to the sources we receive them from. Whenever you immunize and there are leftover vaccines, you pour them away, you throw the vaccines away, and write the numbers that correspond to the amount of vaccines you receive. And that without this, it will show that you are not working. If you don't do this, you can lose your salary. And so I begin to question public health. I begin to wonder, like, when did public health change from people-oriented to numbers-oriented? When did public health lose that vision? And so from that point, I've been very skeptical. Whenever I read reports about the success of programs, number of children who have received services in A, B, and C, I've been very skeptical with those numbers. But I've also been puzzled by the conditions that are still claiming lives today. As I speak to you, malaria, pneumonia, and diarrhea are still among the top causes of deaths, particularly in the developing world. Yet, these are conditions that we have a lot of well-established public health interventions that has been implemented for several years. And so the question is, why? What don't we know about malaria? Let's take just malaria for example. We know that you can use what? Mosquito nets. We have mosquito coils. We have repellents. We know wearing long sleeve shirts can prevent people from mosquito bites. And all these interventions has been rolled out for several years. Yet malaria is still among the top causes of deaths. And so the question is, why? I was once a supervisor for the distribution of mosquito nets. But just before I go on to that story, let's visit some numbers, because I'm talking about numbers. In 2016 alone, $2.7 billion were spent in the prevention and control of malaria. Between 2014 and 2016, 582 million mosquito nets were distributed worldwide. And 87% of these nets were distributed specifically in Africa. But this is the irony. Between 2015 and 2016, the number of malaria cases increased from 211 million to 216 million, a 5 million increase in malaria cases. And so again, we ask the simple question, why? What is happening? So I was a supervisor for the distribution of mosquito nets. The program started out by selling mosquito nets to people, and people did not buy them, and malaria cases were still increasing. So the next move was to distribute these nets free of charge to pregnant women and families with children under 5. But that did not make much change in malaria cases. So the next step in public health was to give out the nets to all families. This time it doesn't matter whether you're a pregnant woman or not. Still, malaria was still on the rock. And so there was this intensive intervention, a final, very aggressive intervention, where myself as a supervisor with a team of volunteers, we will carry the mosquito nets with a hammer and a nail. We will visit the families in their homes and ask them to show us where they sleep. We will enter into the bedroom and hang the nets, because my guess is that families do not know how to hang the nets. And yet, this did not change much in terms of malaria cases. And so again, the most important question we should be asking at this stage is that the numbers we measure and use to develop interventions, what does these numbers mean to the people they represent? So let me share a story with you. There was a man living in a small fishing village in Zambia. This man had 7 children. In this village, the most difficult thing was how to get 1 meal a day, how to feed a family. This is what kept the man awake in the night. This is what he cared about. This is his priority. Yet, in public health, the numbers we crunch and make decisions from were telling us that the problem in this village was malaria, not how a man could feed his family. And so, as usual, a lot of mosquito nets were sent to this village and distributed free of charge. A couple weeks after the distribution of the nets, a reporter from the New York Times who visited the village found that not even a single person in this man's household was sleeping under a mosquito net. Instead, the man had sewn the pieces of nets together to make a big mesh, and he was using that for fishing. And when they interviewed him and asked why he was doing such a thing, he admitted that he knows it's wrong, but that without this nest, his family will not eat. This reflects the disconnect between the numbers we use in public health to develop interventions and the daily realities in the lives of the people represented by these numbers. I try to remind myself that just as my date of birth is meaningless to me, sometimes the numbers we use to develop public health interventions are meaningless to the people they represent. And this usually results in two forms of frustrations. Right now, as a student researcher, the most stressful thing to me is to realize that the work I'm doing is not making any change. It's not impacting any lives. And so on the research end, this frustrates me because I'm putting in a lot of time and effort, and yet I'm not seeing any impact. But also in the community level, there's another form of frustration. When I was a community volunteer, in the community, the question we ask when we see such interventions was that, one, who is deciding for us that malaria is the problem in this village? Who is trying to help us and will not come and talk to us, but instead listen to somebody or figure out in some way a problem that we don't consider to be a problem in our community? And so at the community level, that is the frustration. And on the research end, there's the frustration as well. And so at the end of the day, having been in both worlds, I've realized that numbers are the wall, the concrete barrier that are creating the problems between people who develop these interventions and the communities that receive the interventions. And I think public health interventions and programs will have the most impact and will change the lives and make the world a better place for all, and reduce the frustration both for the intervention people and for the communities, if we will take a little step to recognize the people behind the numbers we use to make the important decisions. Thank you.